Your liver has been quietly working for you every single second of your life, filtering your blood, processing everything you eat and drink, producing bile to digest fats, storing energy, and protecting your entire body from toxins. It performs over 500 vital functions without ever asking for a break. But what happens when this silent guardian starts breaking down? What happens when years of stress, poor diet, infections, or toxic overload push the liver past its limits? The answer is written all over your body, and most people miss the warning signs until the damage has already gone deep. Today on Body Fix, we're going to talk about liver disease, what is actually happening inside your liver, what symptoms you absolutely cannot ignore, and how a powerful group of natural homeopathic medicines, including Chelidonium Q, Cardus marianus Q, Calomeg Q, and Pterodactyl Q, are traditionally used in liver support therapy. We will also cover what else your liver may need when the condition becomes more serious. What is actually happening inside your liver? Think of your liver as your body's most sophisticated filtration and chemical processing plant. Every drop of blood coming from your digestive system passes through the liver before going anywhere else in your body. The liver decides what to keep, what to convert, and what to eliminate. When the liver becomes diseased, whether from viral hepatitis, fatty liver disease, cirrhosis, alcohol-related damage, autoimmune conditions, or toxic overload, this processing plant starts failing. Toxins that should be filtered begin circulating in the blood. Bile that should flow into the digestive system backs up into the blood, turning the skin and eyes yellow. Proteins that the liver should manufacture begin declining, causing fluid accumulation, weakness, and poor healing. The entire body begins suffering because the liver is suffering. The symptoms that tell you something is wrong. Liver disease rarely announces itself dramatically in the early stages. It whispers before it shouts. The earliest symptoms are often dismissed as general fatigue, poor appetite, and mild digestive discomfort. But as the condition progresses, the signals become impossible to ignore. You may feel persistent heaviness or pain on the right side of your abdomen, just under your ribcage. Your skin and the whites of your eyes may develop a yellowish tint. This is jaundice, and it means bile pigment is building up in your blood. Your urine may darken to a deep amber or tea color. Your stools may become unusually pale or clay-colored. Your abdomen may become bloated and distended from fluid accumulation. Your legs and ankles may swell. Itchy skin from bile salt deposits can become unbearable. Nausea, vomiting, loss of appetite, and extreme fatigue follow closely. In more advanced stages, confusion, memory problems, and personality changes can occur, a sign that toxins are reaching the brain. These are serious warning signs that require immediate medical attention. Where homeopathic medicine enters the picture. In traditional homeopathic practice, the liver has always been one of the most studied and treated organs. Generations of homeopathic practitioners have used specific plant-based medicines to support liver function, reduce inflammation, encourage bile flow, and help the body begin its natural repair process. Four of the most respected medicines in this tradition are Chelidonium Q, Cardus marianus Q, Calomeg Q, and Pterodactyl Q. Chelidonium majus Q is derived from the greater celandine plant and is one of homeopathy's most significant liver remedies. It is traditionally associated with right-sided liver pain that radiates through to the right shoulder blade, jaundice, clay-colored stools, nausea, bitter taste in the mouth, and profound fatigue. Practitioners traditionally use it for hepatitis, liver enlargement, and bile duct dysfunction. The traditional dosage often recommended is 20 drops in water taken 3 times daily. Cardus marianus Q, derived from milk thistle, carries the powerful compound silymarin in its source plant, a compound that has received significant scientific interest for its potential liver protective properties. In traditional homeopathic treatment, Cardus marianus is associated with liver congestion, portal hypertension, varicose conditions related to liver dysfunction, jaundice, and early-stage cirrhosis. It is considered one of the most specific remedies for liver cell protection and regeneration support. 20 drops 3 times daily is the traditional recommendation. Calomeg Q, derived from Andrographis paniculata, known as the king of bitters, has deep roots in both Ayurvedic and homeopathic practice as a powerful liver tonic. It is traditionally used for liver infections, liver enlargement, loss of appetite, digestive weakness following liver damage, and sluggish bile production. Its intensely bitter compounds are believed to stimulate liver activity and protect liver tissue from further damage. Again, 20 drops 3 times daily is the commonly recommended traditional dosage. Pterosacum Q, derived from the common dandelion plant, rounds out this powerful combination. In homeopathic tradition, Pterosacum is strongly associated with liver and gallbladder conditions, specifically liver pain, jaundice, gallbladder inflammation, bitter taste, and digestive sluggishness following liver disease. It is believed to support bile flow, reduce liver congestion, and gently stimulate liver cell activity. When the liver condition is more complex or advanced, experienced homeopathic practitioners may also consider additional remedies, like Lycopodium 30, traditionally used for right-sided liver complaints with bloating and digestive weakness, Natrum sulfurum 6X, a biochemic tissue salt associated with liver function, jaundice, and water metabolism disorders, Phosphorus 30, traditionally used for liver inflammation and fatty liver conditions with associated weakness and sensitivity, Chelidonium 200, used in higher potency when acute symptoms are more intense. These additions are typically made based on the complete individual symptom picture and the severity of the condition. It is essential to understand clearly homeopathic medicines represent a traditional system of medicine with a long history of use. They are not a replacement for necessary conventional medical diagnosis, monitoring, or treatment, particularly in serious liver conditions. Always work with a qualified healthcare provider. What your liver needs beyond medicine. No medicine, homeopathic or conventional, works at its best without lifestyle support. Your liver needs you to stop adding to its burden while it tries to heal. Remove alcohol completely. Even small amounts of alcohol are toxic to an already damaged liver. Reduce processed foods, deep-fried foods, and refined sugar, all of which increase liver workload. Increase your intake of bitter greens like bitter gourd, fresh vegetables, turmeric, and warm lemon water in the morning, which traditionally support bile flow. Stay well hydrated. Sleep adequately. The liver performs significant repair work during deep sleep. Maintain a healthy weight, as fatty liver disease is closely linked to excess abdominal fat. When to seek urgent medical attention. If you experience sudden severe abdominal pain, vomiting blood, black tarry stools, extreme confusion, significant yellowing of skin and eyes, or inability to eat or drink, seek professional medical care immediately. These are serious signals that require urgent evaluation. Key takeaways. Your liver is one of the most resilient organs in your body, capable of remarkable regeneration when given the right support. Chelidonium Q, Cardus marianus Q, Calomeg Q, and Taraxacum Q represent a time-honored homeopathic approach to liver support. Combined with genuine lifestyle changes, appropriate nutrition, and proper medical monitoring, many people with liver conditions experience significant improvement in their quality of life. Understand your body. Listen to its signals. Give your liver the respect it has always given you. If this video helped you understand liver health more clearly, subscribe to BodyFix and stay with us for more honest, research-driven health education. If you have a question about liver disease or any other health condition, leave it in the comments below. We read every question and may reply. And if someone you love is struggling with liver problems, share this video with them today. One share could change someone's health journey completely.